This episode contains material that might be triggering for some. If you need to stop the podcast at any time to take care of yourself, please do so.
If you need support, you can call the 24/7 National Suicide Prevention Lifeline at 1-800-273-8255. Dialectical behavior therapy was created in the 1980s by Marsha Linehan in Seattle, Washington.
Today, DBT is taught all over the world.
We're two therapists who believe everyone can benefit from DBT skills.
I'm Kate.
I'm Michelle.
And this is DBT and Me. Hello, everyone, and welcome.
Hi, guys.
We have a guest here today. We're very excited to be talking to Whitney, who I just realized I probably ought to have gotten your last name also. That would have been a good idea. But we'll get there with your introduction in a minute. Anyway, we have Whitney with us today to talk about perinatal mental health, specifically DBT for perinatal mental health, which is very exciting. But before we launch into the subject and our various introductions, quickly do some promotion for folks. So if you want to help support us and keep us going here on the podcast, you can do that through Patreon at patreon.com/dbtandme or by purchasing stuff at our Etsy store. Just go to Etsy and once again search for DBT and Me podcast. You can also rate and review us on Apple Podcasts or wherever you are listening to us today, tonight, this afternoon, this morning, whatever time of day it is where you are. You can also reach us at our Facebook group. Just search for the other one. Also, The Couch and the Chair is our other podcast, which I was about to mention, and apparently my mouth was just ahead of me. DBT and Me podcast, or The Couch and the Chair, either one of us. We have Facebook groups for both. Please do check out the other podcast, The Couch and the Chair. It needs love. And speaking of The Couch and the Chair, we have a couple of episodes that we've already done historically that speak to a lot of the issues adjacent to what we're going to be talking about today. So if you want to dive more in depth on some of those issues, we have one on the fourth trimester that we released on the 27th of January last year in 2023. And we also have one on pregnancy loss, abortion, and infertility issues that we put out on the 25th of June in 2021. So both of those talk to Michelle and mine's respectively, both of our relationships with this issue. I'll admit that when Michelle first brought this up, you're like, so you can talk about your relationship to this issue in the introduction, Kate. I was like, what? Because my initial concept of perinatal mental health was like, Michelle, right now, pregnant person, right in front of me. Like, your mental health, that's what this is. So I actually really enjoyed talking about getting ready for this episode, and I'm going to be really interested in listening to more of what Whitney has to say, because I had too narrow-minded of a concept of it. And it includes really just our relationship to parenthood and how that impacts our emotions and our mental health. And so, yeah, I'm sure you guys will learn more about it along with me as we continue to do the whole episode here with Whitney. But for now, along with your last name, why don't you tell us more about yourself, Whitney?
Well, hello, and thank you for having me. I'm super excited to be here and share the space with you, especially on such a special episode. I'm Whitney Frost, and I'm a licensed professional therapist. I'm a certified DBT therapist and a perinatal mental health specialist, along with a bunch of other titles: clinical supervisor, author, and a mom. I founded and I run Colorado's largest perinatal mental health collective, the Riley Center for Hope and Healing. So I specialize in perinatal mental health, so I feel like I could probably give you a really good definition of what perinatal mental health is, and all that it encompasses.
Fantastic. We're glad to have somebody who's more knowledgeable, bare minimum, than I am. I think Michelle was also a little bit more in on this than I was.
Well, and it goes by so many things. It could be perinatal mental health. It could be maternal mental health. There's a million different terms for it, and what it encompasses, what it looks like. It's a lot.
That's fair. All right. If you wanted to tell more about that, or Michelle, did you want to go into your intro? How are we feeling?
Yeah, I'll talk a little bit about, we were thinking that diving into this topic, it might be helpful for all of us, right? Like myself, Kate, and Whitney to each share a little bit of our personal backgrounds with this topic. So yeah, I can share a little bit about mine, and then maybe Whitney, I'll turn it back over to you, so we can also just hear more about like your personal journey,
Personal life
to motherhood,
yeah.
like what's that look like. But I'll kick it off. So yeah, I mean, as Kate said, we've mentioned it on a couple recent podcast episodes, just briefly here and there. So, but I am pregnant with
What?
right.
Shocker.
Whitney had no idea. No, okay.
No idea.
It was so perfect, actually, when Whitney and I connected, and she was like, I want to be a guest on the podcast. I was like, well, what's your jam? Like, what do you want to talk about? She was like, I do perinatal mental health. And I was like, funny thing about that, I'm very pregnant, and this is my last episode that we're recording before I go on my maternity leave. So this is perfect timing.
Sweet timing.
Yeah. Very good timing.
Totally kismet.
Yeah, no, really. It honestly was. It just perfectly lined up that this is the timing of when we're talking about this topic, because yeah, I am very pregnant with my second child. And when I say very pregnant, I mean like I'm less than 10 days away from my scheduled C-section date. So this is very timely. And, Kate mentioned a couple episodes on the couch in the chair where we talk much more in depth about our histories when it comes to what it has looked like to reach present day for each of us with this topic of parenthood and struggles and that kind of a thing. But just to share a little bit briefly to catch those of you up to speed who may not know some of my background on this topic. So my husband and I decided after we got married in 2019 that January 2020 we were going to start trying to conceive. And we did. Yeah, exactly. Having no idea what was just going to be around the corner for the world. So I went off my birth control pill. We started trying to conceive. And lo and behold, a few months later, in April, I took a positive pregnancy test, which was very, very exciting. And unfortunately, just before I was 8 weeks pregnant, I had a miscarriage. And that hit really, really hard. It's a very difficult loss to go through. And after we lost that baby, it took a few months before we felt ready to start trying to conceive again. And we did. We started trying to conceive again, like kind of towards the end of the summer. And all things considered, it didn't take us that long to conceive compared to many people who do struggle with infertility and conception. But those were like the longest 7 months of my life. Every single month, like hoping that this would be the month, this would be the month, this would be the month, and it wasn't. And so I reached the end of 2020 not being pregnant. And that was tough. And so I entered 2021 and I just really had to reach this place within myself of like, Michelle, whatever happens, happens. You gotta let go of thinking that there's like some perfect way to get pregnant. Like there's just not. And then I took another positive pregnancy test in February 2021. And that was when I was pregnant with my son. And I was terrified because I was scared of history repeating itself, and I was scared of losing him. And I really did not feel comfortable in that pregnancy until I reached the third trimester. I was just so scared of something going wrong. And I was also experiencing pregnancy symptoms with him that I had never experienced when I was pregnant the first time, for the brief period of time that I was pregnant. And like, holy shit, being pregnant is, it's just hard. You can't expect what's going to happen in your body. It is so much more than just feeling nauseated. And all things considered, I had a pretty smooth pregnancy with him, and it was still hard. Physically, it was hard emotionally. But he was born in November 2021, and then you launch into parenthood. And, I talk about this a lot on the episode Kate referenced about the fourth trimester, just what those first few months are like. And you are just so in this space of just survival and just trying to get through each day and trying to learn what it means to take care of this tiny little human and worrying about every little thing, and you don't know what you're doing. And it's so much, especially during those first few months. But I mean, the whole first year, they're just changing so much. Every single month is so different. And so that whole first year of his life, um, it was just kind of constantly trying to learn and figure out, nursing and feeding him solids and just all of these things. And then once he turned a year old, it felt a lot easier for me. And even since he's turned two, it's felt a lot easier in a lot of ways, to attend to his needs and just feeling more settled as a mom. Um, but, I'm pregnant now again, and my husband and I had kind of started talking about, like, oh, maybe we'll start trying to have, another baby in like fall of, uh, now I'm blanking on the timeline. We're 2024. So we were thinking again, like, yeah, maybe fall of 2023. Once he's around two, we'll start trying. Well, we got pregnant summer. Summer of 2023. Not fall, summer. Not trying at all to get pregnant. So it was a very different experience compared to trying to conceive with my son, where it was again like month after month after month of not being pregnant. And then it happened very quickly and very easily this time around, which shocked me. And this pregnancy experience has been wildly different, keeping up with a toddler and trying to balance like taking care again of like all the things that he needs, but like my body, and trying to like connect with this new baby. Uh, it's just so different when you're pregnant again after already having another child that you're tending to. Um, and I know that's really normal, but it's also something where I just kind of feel like, wow, these past, 9 months have just flown by, and I feel like I haven't connected with her as much as I've wanted to, in the same way that I did when I was pregnant with him, because life is just so different. And so going into thinking about her arrival and going through the fourth trimester again, I do feel a decent amount of like fear. But in some ways, I also feel more confident. It's like revisiting a place you've been before. Even if you haven't been there in a long time, you were once there. And that helps to remember that a little bit of like, okay, I am going to remember some things. And, we kind of have this established rhythm with Noah, my son, and okay, we're just gonna kind of fit her into this, and like it's gonna be so different, but in a way that I hope will really feel more, I don't know, empowering, less like I'm floundering. It may have been a while since I've ridden this bike, but I have ridden it before, is what I'm kind of telling myself. So that's where I'm at, and that's a little bit of my background with this topic. Yeah, but Whitney, what about you, if you want to share a little more personally, and then we'll turn it over to Kate.
Sure, sure. So I had my first child in 2015, and got pregnant with her completely on accident, unexpectedly, um, and had plans for my pregnancy with her to actually be very high risk because I have epilepsy, and had brain surgery in 2008, and had actually been told most of my adolescent years since then that conceiving and carrying a child would be really difficult and be really high risk, but my pregnancy with her was actually really smooth. And so I was kind of shocked by that experience, and everything had gone really well. I had a planned C-section of 38 weeks, and it was normal and fine. And I'm getting ready to leave the hospital with this new baby, and they tell me I can't leave. What do you mean I can't leave? They're like, well, we think that we've found something wrong with your baby's heart. What do you mean? I've been to maternal fetal medicine. We've done all of the scans imaginable. Everything's fine with my baby. And they're like, actually, no, we're going to do an echo and then we'll let you know. And so they come up with this big machine, and they're scanning my 3-day-old baby, and they find 2 holes in her heart. What do you mean there's holes in her heart? We've scanned her when she was still in utero. There's nothing wrong. And they're like, actually, yeah, there are. And, we'll send you home after the pediatrician comes back by, and then you can follow up with cardiology in a couple of weeks. So she was diagnosed with a VSD and an ASD. So a hole in each chamber of her heart, like the walls of her heart. And they're like, okay, so they're small enough that we'll just, watch them as she grows. And if she turns purple while she's eating or while she's crying or any of these things, call 911. And I'm a brand new parent. I'm like, excuse me, what? If she turns purple when she's crying, don't babies turn purple when they cry really hard? Like, what? So then they just send me home with this information, and I'm terrified. And so I lose sleep and become really anxious and get really stressed out and develop all of those classic signs of postpartum depression and anxiety. And I'm a trained clinician at this point, and I start to notice it, but there's no support at this point. My pediatrician didn't screen me. My OB didn't screen me. No one even really talked to me about those signs or symptoms. I just kind of have it tucked away in the back of my mind from grad school. And then it started to really get bad around 8 to 12 weeks postpartum. And I was like, wow, I'm really freaking depressed. So I went to my primary care, and I'm like, hey, I don't think I'm doing well. And he's like, yeah, you should probably talk to someone. Telling me as a therapist I should go talk to someone. I'm like, yeah, you're right. He's like, but here's an antidepressant too. I'm like, okay, cool, thanks. And taking an antidepressant helped. I stayed on it, and I found a therapist to talk to that didn't necessarily specialize in perinatal mental health, but she worked, and she was a mom, so she could validate some of my feelings and kind of did enough. But we got through it, and fast forward 8 years, the holes in her hearts have closed. She didn't need surgery, and nothing crazy came out of it, but it was still that lingering anxiety of my child has holes in her heart, and we don't know what that means for her or how that will impact her growing up and being a mother, or physical activity and how that will limit her. And we were kind of just told, well, check in every couple of years. Cardiology will scan her heart, and it's okay. But when she was 16 months, we decided that we would consider having another child. And we got pregnant pretty easily. And I went in for my 8-week scan, and they measured and said everything looked good, but why don't you come back? There's just something that looks a little funky. And so I came back at 16 weeks, and the ultrasound tech told me that something was off and I needed to stay to see the doctor. And the doctor had told me that the pregnancy had developed without a heartbeat, and that I needed to have a D&C that week, that the baby had developed abnormally and that my body hadn't taken care of it in that time frame. And so my body wouldn't take care of it. So I needed to have a D&C at that point, which was devastating that, not only could I not trust my body to do what my body should do, but also that, this pregnancy that, we had trusted was doing well at 8 weeks, had demised in an 8-week time frame. And, we wouldn't have these babies close in age. It was really hard to deal with. And we went on to continue to try, and we suffered 6 more losses after that before conceiving our 4-year-old. So our girls are 4.5 years different. And now we have Everly, who was born in January of 2020, right before the world shut down.
Yeah.
And was an incredibly stressful pregnancy. Any risk factor you can imagine I had. I was in maternal fetal medicine twice a week, every week from 16 weeks on. She had growth restrictions. She was a mess. They were talking about inducing me at 34 weeks just because she wasn't growing. And we went in for that ultrasound to decide if we were going to deliver at 34 weeks or not. And girlfriend had gone from the 20th percentile to the 75th percentile in growth. And her maternal fetal medicine doctor was stunned. He was like, I'm going to repeat those measurements because not that I don't trust my ultrasound technician, but I've never seen anything like this in my career. I'm like, okay, cool. You guys scan me every week, twice a week. Go for it. What's one more? And he was stunned. And now having Everly Earthside, that's so her personality. She is sassy and defies all the odds. So when you're talking about, things got easier at 1 year and 2 year, just wait till 4. That's when they get difficult again.
Look out.
It gets spicy and oh man, it's like the teenage years, but in a tiny little body, and they scream a lot.
Good to know.
So my journey with motherhood has been anything but typical, and I think that's why I'm so deeply passionate about this work, because I've seen the really dark sides of things, and I've seen what it's like to not be able to access the resources you need, and that's been a really strong driving force for why I do this, and actually why I opened my Perinatal Collective. I want to be able to give families, give these birthing folks and women these resources that they can trust and access when they need them in a timely manner.
That's awesome. Thank you so much for sharing so openly and vulnerably about something that I know is hard to talk about. I will go into my brief background. Again, like Michelle talked about, we've talked about this a bunch. If you guys, I guess we didn't list it, but if you go back to the whatever the original radical acceptance episode is, I talk a lot about what I'm going to be sharing here. So if you guys have been with us for a while, you've heard it. But in brief, I guess still do. It's a weird way of saying always have. Like it's a past tense thing. Like being a mother was an assumption of my life for all of my life, pretty much since I was about 3 years old. I just knew that I was going to be a mom, which made it incredibly difficult when I was 17 and came up pregnant unintentionally. I knew that I was constitutionally incapable of giving a child of mine to adoption. I knew you would have to pry any kid that came out of me out of my cold dead hands. And I also knew that I was not mentally well. I was not at a place where I could be a functional mother to a human being and hope to do any kind of justice to the role. And so despite the fact that I always knew I wanted to be a mother and in many ways being pregnant was the most exciting thing that had ever happened to me, I also chose to terminate the pregnancy. My wise mind, there we go, we'll just keep using DBT terms. My wise mind still knows that was the correct choice. And from the moment I chose to have that abortion on, I neatly installed a new worst fear in the whole wide world. My worst fear was that was the only chance I was ever going to get to be pregnant. And that I would have terminated the only pregnancy that I was ever going to have. And it turns out that was true. I found out when I was, I think, 32. Found out that when I was 32, that sometime between the ages of 32 and 17, I became sterile. I used to say infertile because it feels better. But sterile is technically appropriate. My eggs don't anymore. So not only do I'm postmenopausal technically, so I don't have periods and haven't in 8 years. But also my eggs are not harvestable because you need to get your eggs to develop to be released follicularly, right? In order to harvest your eggs. And that's the whole process my body has decided to fuck off about. I produce lots of follicle stimulating hormone, and apparently my ovaries have their fingers in their ears. And are not listening. For no discernible reason. Idiopathic premature ovarian failure, if you want the mouthful diagnosis. Idiopathic just means we don't know. It's demonstrably true that your ovaries are not functioning anymore, and it's way sooner than they should, but we don't know why. That's what that really means. And so it's, I don't know. There's not a single day that this isn't a weirdness in my life. I'm both incredibly grateful that I have Michelle in my life because she's the only person since I've found out that I was sterile that's decided to breed in my vicinity. And I would have been very sad if I didn't get to be intimately, close to anybody's pregnancies after finding that out. That being said, this isn't news to Michelle. My life would have in some ways been much more emotionally easy if I had never had to be around someone who was pregnant after finding out I was sterile. So a nice dialectic there. But it's weird. It's weird every day. It's painful and weird every day of my life that I'm not a mother and that there's still possibilities, I think, of things like adopting older kids or things like that. If I won the lottery, I'd probably still try with IVF for the next year or two. But most of the time, I have to sit with the whole radical acceptance thing of just I'm probably not going to be a mom, and I am certainly never going to be a mother the way I expected to be. And that's wild. It's different on different days, but it's always there, right? It's always like this weird constant surprise to my life. So yeah, my relationship to this whole thing is one of yearning, I guess, and loss in many ways. So and envy, damn it, not jealousy, because it's not the right word. Anyway, sorry, I have to put a little bit of my pedantry in here. I'm envious of you bitches who are able to breed, not jealous. So yeah, I think that's me, and I think that just pivots to you as asking the first real interview question then, Michelle.
Yeah. Yep, we're going to start asking Whitney questions and hearing all that she has to share. In typical fashion, the first two questions that we're going to ask are the questions that we ask all of our guests. So I'm going to ask the first one, which is, Whitney, when did you first come across DBT, and what drew you to it? What did you like about it initially? What made you want to do it?
Sure. So I came across DBT when I was working in community mental health as an intern. I had a supervisor who was on our DBT core team, and she was extremely passionate about DBT. She drank the Kool-Aid, and had suggested that I get trained in it after I had encountered my first real client that showed a lot of signs and symptoms of BPD, my like first or second week as an intern. And I was like, what do I do with this client? She's so mean to me. And I remember my supervisor looking at me and be like, what do you know about DBT? I'm like, I don't know, like nothing. She's like, so like we have the team here, like we could get you trained. I'm like, oh, okay. Do I still have to see that girl? She's like, no, we can get her transferred, but let's get you trained. And I was like, okay, cool. Let's do that. And I mean, she was such this like solid force in my life and my supervision experience as I got trained and as I drank the Kool-Aid ultimately. And I mean, it really changed my experience in community mental health, but also just like being a therapist in general, honestly. I think DBT saved me as a clinician in community mental health. But I think in general, DBT skills as a whole are just so applicable to everyone. They're just good life skills, honestly. I say all the time that I wish that we could be teaching DBT in school settings because we would be turning out healthier students every freaking day.
Word.
Honestly, it should be such a part of curriculum, not just like general mental health. We need to be teaching DBT in schools. Mindfulness, emotion regulation, just general interpersonal skills. Like our kids would be so much healthier. But I mean, they're just great life skills. And I love how transferable they are from clients to clients. I could be using these skills with a client that may have, clinical indicators for BPD, but then I'm talking to a mom who's in the trenches of postpartum depression using the same exact skills in a very different way. I just love how accessible they are for any client. I teach my 8-year-old mindfulness to help her fall asleep at night. But then I also teach, 21-year-old clients mindfulness that are really anxious. So it's really just beautiful how these skills are transferable and accessible in so many settings. And I love being able to share that with folks, honestly.
I'm going to guess then that that's going to be part of your answer to my next question, which is one part is what's your favorite thing about DBT? So I'm going to guess some of that accessibility and transferability will show up there, but also what's your least favorite thing? Like what's something you would change or a foible or flaw that you see in it?
Yes, definitely love how accessible DBT is, and just how truly applicable it is to so many variety of situations in life, honestly. And it's just a great skill to have for anything. You don't have to be struggling with a mental health diagnosis to apply a DBT skill to your life. Pick up a deer man and learn how to communicate with someone. I think we all could use that. But I think I really struggle with, gold standard DBT and how rigid it is. When you think about how rigid the gold standard DBT treatment is, I think it prohibits a lot of folks from accessing and completing DBT treatment programs when they could really benefit from it. And I think that's also true for therapists. I think a lot of therapists are afraid to get trained in DBT because of the stigma, but also because they have this idea in their mind of how rigid it has to be implemented. And they're like, I can't do that. I don't work in community mental health. I don't work in a group setting that's going to really provide that structure around the potential liability. And like, I can't implement that in my private practice, so I'm not going to get trained in it.
Yep. Yeah, I definitely think that is something where, yeah, it can feel as a professional intimidating to get trained in DBT or to, go on that path to certification. Like there's a lot of hoops to jump through, like professionally, if that's the route you're gonna go. And then yeah, how do we make it so that there's not as many hoops for clients to jump
Yeah,
through? Yeah, definitely, I would
totally.
agree with that. Yeah.
Absolutely.
Well, like we were talking about at the very beginning with this term perinatal mental health,
Yeah.
um, you know, you shared beautifully, your journey and all that you've gone through. And it sounds like, I mean, that is really what drew you professionally to doing this work. So, but yeah, if there's anything else that really got you to the point where you were like, this is my calling, this is what I want to do, I mean, I'd love to hear that. But in general, like we were saying, can you also explain what is under that umbrella of the term perinatal mental health so that people can better understand? I mean, you're the perfect person to, talk about what does that really mean? What is really perinatal mental health?
Yes, absolutely. So perinatal mental health encompasses the lifespan of a human from preconception through the first 2 years postpartum. So we're
Mm.
thinking like planning to have a baby all the way through like the first 2 years postpartum. And I know like the DSM likes to go back and forth and say postpartum is only like the first year. No.
Yeah.
Technically, postpartum is forever because, like, after you have a baby, you're forever postpartum. But, like, when we're thinking about it from, like, a clinical standpoint, it's the first 2 years. So, when we say preconception, or we say preconception because many folks will face infertility struggles when they're thinking about, trying to have a baby. A lot of people think, oh, I'll just come off my birth control or I'll take out my IUD
Mhm.
and then I'll get pregnant. Not that easy. Your body has to adjust to coming off birth control or coming off hormones or adjust to whatever craziness is going on in your body. People may figure out that they have PCOS, but it's been masked because you've been on birth control for years. And so you weren't having periods because you're on birth control, but really you weren't having periods because you have PCOS and you just thought it was because of your birth control. So there's a lot of stuff going on underneath all of that. But we do a really terrible job in our country talking about women's health and like women's reproductive health because like we live in a male dominated society and like who wants to talk about women's health? That's not fun. So we do a really terrible job about educating women and girls about their body. We say, oh, you have painful periods, take some birth control. So we start talking about preconception because there's a lot that goes into that. And a lot of that really messes with women's health and their mental health of,
Mm.
oh, I've been on birth control since I was 14. Now I'm coming off and I feel terrible. I have anxiety. I have depression. What do I do? All of that falls under that perinatal mental health umbrella of I'm trying
Mm.
to conceive, my mental health is a wreck. All of this is really playing into this. Additionally, IVF, IUI, all of those treatments that go into trying to have a baby, it wrecks your body and it wrecks your mental health. So all of that falls into that umbrella. And a trained perinatal mental health specialist knows how to tackle those issues specific to all of
Mm.
those things.
Yeah.
So
Awesome.
it's a lot. We do the preconception, we do the pregnancy, we do the postpartum. And, it's a really intricate balance of being able to be trained in all of those things and specialize in it. It's not just, oh, you're sad because you had a baby, let's talk about it. It's a lot that goes into it. And
Not so
like,
generic. Yeah.
not so generic. No, not at all. It's Neapolitan. It's a lot of different flavors.
I
And
like
then, like
that.
we talked about, I got into this work after my own struggles with postpartum depression, postpartum anxiety, and infertility. Um, like we talked about giving birth in 2015 and tackling, my own postpartum depression and a lot of anxieties with my daughter's health concerns. And then secondary infertility was a big struggle. I learned I had PCOS during that journey, and
Mm.
that has been an ongoing struggle for me. I had a hysterectomy at 31, which,
Mm.
was an elective procedure for me, primarily because being in a male-dominated medical community, no one knew how to treat PCOS appropriately aside from throwing birth control at me, which wasn't something I wanted to do.
Yeah.
So I've learned a lot from not only the therapeutic community, but the medical community of how to advocate for my patients and what they need and how to take care of themselves, both therapeutically but also medically, and how that looks for a woman navigating the medical world, which can be really hard.
Yeah, I've had a terrible time navigating medical stuff from time to time.
Yeah,
So,
absolutely. It's a difficult, difficult journey for sure.
yeah. And yeah, I won't go into it because it's too much of the story. But yeah, I was definitely dismissed around some of my own infertility stuff to start with from my male
Absolutely.
PCP at the time.
Absolutely. I had a male provider give me an IUD and refuse to take it out when it was making me feel suicidal. But Planned Parenthood is an incredible champion for
Yes,
women's health, and
absolutely.
they saw me immediately and took care of it and were incredible.
Well, thank you so much for giving that much more in-depth, yeah, discussion of the whole umbrella of what is carried underneath perinatal mental health. What are some of the biggest struggles that you see, like in the population that you serve, or perhaps what's some of the stuff that we don't always hear about
Absolutely.
as, yeah, part of
I
our
think
social narratives?
I think especially right now, accessibility to care and payment for that care is a big thing. And I think we as therapists see it a lot, but insurance paying for the things that are needed.
Mm,
Insurance panels don't cover care for doulas or
yeah.
necessarily for lactation support. And we know right now in America that we have the highest maternal mortality rate of any developed nation in the world. And doulas reduce the risk of maternal mortality and postpartum complications, especially in communities of color, but no
Mm,
insurance panel covers them right now.
nice.
And it's pretty ridiculous. Here in Colorado, our Medicaid panels are starting to cover doulas next year.
Mm,
But the red tape around it and the conversations around it are very slow going, and I don't imagine it being a fully accessible thing for a couple more years. But they're starting the conversations. Just because Medicaid's doing it doesn't mean the other panels
yeah.
are going to jump on. So, I mean, accessibility to care is a big thing, and payment for care.
Yeah. Yeah. I'll just share a little bit personally because I don't know if you guys have a program like this in Colorado. But one of the things that I think for me with my son that I underestimated like how much I would need is to have my husband take time off with me.
Yes.
And so, of course, right, we know in this country federally we have FMLA, right, that a pregnant person can take X number of weeks off after giving birth. They have a right to that. However, in many states, that is unpaid time
Unpaid.
off.
It protects your job, but it's unpaid.
Exactly. Yep. So, okay, we'll give you a couple months off, and you'll still have your job when you come back. But good luck paying your bills during that time when you have
Yeah.
no income coming in.
Yeah. Good luck
Luckily,
not losing your house.
yep. Yeah. Exactly. And then luckily in Washington state, I think this started actually at the beginning of 2020. We now have a paid family medical leave program in this state. And I
Yes.
know a couple other states do, but there are many states that don't. Um, and that means this happened with my son. This is going to happen again this pregnancy. I, as the pregnant person, get between like 16 and 18 weeks paid time off because, my body is the one that goes through the birth experience. My husband, as my partner, gets 12 weeks of paid time off.
Mm,
Um, and I will be very honest with you because, like, I did not experience postpartum depression or anxiety with my son, but I honestly think that's a big reason why. Was because I had my husband with me every single day for those first few months. So like if I needed to take a shower, which was still like really hard to do, or if I
Of
needed to take a
course.
nap, which was still really hard to do, but I wasn't alone. It wasn't a situation where, like, oh, he maxed out his vacation time and he took off a week or two and then he went right back. I had him by my side every day for months. And
That's huge.
it's so huge, exactly. Like, and I think that's the stuff that, like, policy wise, really needs to change in this country. I love that you're talking about, like, we need to really make sure that insurance is covering the cost of, more things like, fertility treatments and like doulas and all this stuff. I mean, that is so, so important. And yeah, we need to make sure that we're just better supporting families.
Well, and I mean, so many of those frontline providers, nurses, MDs, primary cares, OBGYNs, they're not necessarily trauma informed folks either. Because just because they're supporting you as you're delivering this baby, that doesn't necessarily mean that they're trauma informed. They don't know how to necessarily support you when you're a birthing person that has, experienced sexual assault in your history or anything like that. But when you have a doula that has supported you your entire pregnancy and knows your history, knows how to support you, knows your birth plan and your backup birth plan, they're that person that can support you and be that go between you and your non-trauma informed provider. And that's essential in making sure that we're having healthy outcomes for birthing people.
Yeah, totally. Yeah. I had no idea all the things that doulas could do. Like,
Oh yeah.
doulas are the most amazing people ever, but there's so many, right, that I didn't know about, like, professionally, like
Yeah.
pelvic floor physical therapists,
Yep.
lactation consultants. I mean, there are just so many different professionals that are not always widely recognized,
Absolutely.
who do the work, like, once this baby arrives to support.
Absolutely. And even before the baby gets here,
Yeah.
you can go see a pelvic floor therapist while you're pregnant to make sure that like your core is in good shape, to make sure your pelvic floor is in good shape for birth. That's actually why I created my collective. I have all of those professionals in one place that bill insurance, that have been vetted, are trauma informed, that families can come to and access in one spot and know that
Mm.
we talk to each other and that they can trust who is in this place, to know that they're safe, they're trauma informed, and they don't have to piece together their care when they're facing infertility, when they're newly postpartum and sleep deprived and have no freaking idea what's going on, if it's up or down, if they take your insurance or not. That was the whole point of having this experience in this collective for families.
Amazing. Absolutely amazing.
And and to circle back to you, Colorado did pass family leave.
Okay.
We voted on it in 2022, something like that. It started this year. So
Mm.
families started accessing it in January. It's still a total shit show, to be honest with you.
Yeah, yeah, it will be for a
Oh,
while, probably.
I mean, I have clients tell me all the time that like I plugged in my employer's information and I got this like red flagged where my employer has leave, so I can't use state leave in conjunction with my employer's leave, and like my husband can't use it because of the same thing. So it's a nightmare still. We're still figuring it out, but I mean, we're only 4 months into it, so I figured that would be the case. I wish I had that available with my girls, especially with my 4-year old, because I was in private practice. I went back to work 6 weeks postpartum. I was seeing clients virtually before telehealth was cool from my bed because I had had a C-section, and I was like, I don't think I can drive yet. I'm just gonna like sit in my bed and like see clients. And my husband went back to work at 2 weeks postpartum. And I was like, I have no idea how I can manage this.
Hmm. Yeah,
It was
yeah,
not.
exactly. That's what happens so often, and I'm
Oh,
glad to
yeah.
hear that now Colorado has the program, and I just hope eventually it will be in every state because it would be a
I
game
hope so.
changer.
I really hope so. I mean, it's such a necessary piece of raising healthy families. We shouldn't be sending birthing folks back to work, a week, 10 days after giving birth. That's
Mm-hmm.
just inhumane. We can't separate dogs from their babies until 6 to 8 weeks. Why are we separating birthing folks from their babies at a week?
Yep.
Mm.
That's not right.
I could not agree more. Uh, I guess we'll bring DBT into the conversation a little bit here. We'll come back to that.
I
No,
get a
I mean, I
little
could talk.
sidetracked when we talk about these things that
No,
I'm deeply passionate
this is
about.
so important. I know I could talk about it all day long. Because this is the stuff that attention needs to be brought to. Absolutely.
Absolutely.
Um, when it comes to being a DBT therapist, and I mean, you gave some examples of this briefly a little bit ago, where you're like, seeing the different clients that you do DBT with and just how you've brought it in a little bit to like your personal life, like with your daughter and stuff like that. But in general, like how do you tend to incorporate DBT into the work that you do on a daily basis, like especially with this, perinatal population? And like, are there any particular skills that you really find yourself talking about over and over and over again, like the ones that if we have listeners who are, really resonating with their like, oh yeah, I'm thinking about trying to conceive, or I'm pregnant, or yeah, I have, a young child at home, whatever their situation may be. What are like, skills that you're like, these are really some good ones to keep an eye out for? So a couple different parts to that question, I guess.
Yeah. I think I lean most into distress tolerance skills with this population in particular. Um, where it's, a new parent or someone that's pregnant going through infertility treatment, I think distress tolerance skills are like right where they live.
Yep.
Because there's so much about, trying to conceive, early parenthood, that is so distressing. And I think with distress tolerance skills too, they're just so accessible that you can just grab it and manage it, in something that is so intense in the moment, grabbing a tip skill and being able, dunk your head in some ice, put a freezy pack on your face, being able to do something like that, or a quick run up and down the stairs for a couple of minutes. Like, there is something so easy about that when you're in the moment and really activated in parenthood. So I think there's a lot to be said about using those distress tolerance skills in this phase of life. Same with emotion regulation skills, for those exact reasons as well. I also find with this population, there's so much frequent fluctuation of emotions, because, oftentimes hormones are all over the place that, you can find just really feeling a loss of control oftentimes. So being able to dig into distress tolerance and emotion regulation
Yeah.
skills and find that sense of control again can be really, really helpful. I was thinking about, what are my go-to skills? And I think self-soothing, check
Yeah.
the facts, tip, and dear man. Um,
Nice.
Especially when, you're kind of feeling like a crazy person because hormones have taken over your body, and feeling like, oh my God, my partner hates me. Why did I do this with this person? Like, what have I done? I think getting back and using that dear man to find some healthy communication links can be so, so important with my couples. Um, and then, self-soothing and tip and check the facts just really help get grounded back into reality, feel back in control of your body, and help you figure out, like, okay, this is really a perception, not a fact. I need to get back to like checking in with who I am, where I'm at. And those skills, I feel like, are really accessible and can help you feel back in control of your thoughts, your body, your reality very quickly.
You mention accessibility. That's the thing you come back to a lot, and I know that you actually did run a gold standard DBT program for people who were new
Yes.
parents. How
Yes.
do you mesh those ideas? How do you make DBT accessible for people who are in the throes of new parenthood?
Accessibility is a big thing in both of my practices. I feel really strongly about making sure therapy and quality therapy is something that's accessible both financially and physically for
Mhm.
anyone. So running a gold standard DBT program, I came out of community mental health being like, oh man, how am I going to implement this in private practice? And so, you know, with that in mind, being taught gold standard DBT was super rigid and almost kind of harsh.
Yep.
But I've learned how to implement these programs into the community and make sure that, I'm keeping strong boundaries without being rigid and inflexible. I think having that open line of communication with folks, and knowing that, yes, parenthood has to be flexible. I offered my groups at various times. Oh, okay, here's a daytime group around lunch when parents are probably having nap time for kiddos. Here's an evening time group where, you may be doing group, but maybe you can find some childcare for your kiddo, maybe with your other partner or with childcare or grandparents, something like that, to where they have the expectation. I set the standard ahead of time as far as rules, expectations, and those meeting norms. But I also had the expectation with some new parents around, like, I understand we may have to have a kiddo pop in with groups sometimes for feeding because that's part of parenthood, and having that expectation ahead of time to where if that was going to be triggering for someone that had had a loss or was struggling with infertility, we talked about that in the norming phase of the group. Does this person need to just turn off their camera? Maybe this isn't the appropriate group to have a new parent in or someone who's struggling with loss. I tried to have that communication very open while we were norming, to where this was an open dialogue for everyone and it was a safe place to have it, because DBT group is a safe place to feel your feelings. So I found that you can run a gold standard group without being overly rigid and inflexible, but still have those boundaries in place of like, this is what you expect from this group without being an asshole.
Yeah, yeah, and I remember, yeah, when we were first meeting you, because with all of our guests, we set up a meeting time prior to when we record so we could get to know each other a little bit. And yeah, I remember being so impressed with all the things that you shared with me about all the really like intentionality that you put into designing your group. And like you said, just making sure that it's going to be affordable, covered by insurance, like just thinking about any reasons that people might have to be like, no, this isn't for me, right? It costs too much.
Exactly.
Yep. It's not at a good time of day, right? Or like just whatever it was. And just being like, okay, I'm just gonna take those barriers away. I'm gonna find a way, and you've been so successful with it, which is very, very cool.
Thank you. Thank you.
Yeah.
Especially with DBT, I want people to be able to utilize it because it is such a great modality, and I want more people to be aware of it and see the benefits of it. So if we can take those barriers away, there's a practice down the street that runs a like by the book 16-week program of like group and individual and phone coaching and things like that. They charge $3,600 for the whole thing. They don't take insurance. It's only cash pay. I'm like, there's no freaking way that anyone, that's truly in a crisis or as a parent, as a new parent, could access that. So no. What are they doing? How can I do it and make it more accessible to everyone? So I did that. And I offer the same quality that they do because I interviewed with them and they offered me a position with them. So I know that I do what they do.
Yeah. Well, and another cool thing that you do as part of your work is that, you do trainings for mental health providers, right? So it's not just that you're overseeing a clinic and, working with clients, which is plenty, but you also, do trainings for people who are wanting to, learn DBT and that kind of a thing. So, we have a lot of listeners who are mental health professionals. They're either currently practicing as mental health professionals or they're in school to become mental health professionals. So for those listening who may be thinking to themselves, ooh, actually, this sounds like a sweet spot for me where like I want to do DBT and I would love to work with this, perinatal mental health population, that they feel maybe drawn to this work. Like, what are the biggest recommendations that you have for them of like, here's how you can start bringing some DBT in with your clients that you have who, yeah, might be pregnant or might be, struggling to conceive, or, where would you recommend they start from a professional standpoint with that?
Absolutely. I mean, I think I would encourage anyone to not get caught up in the idea that DBT can only be implemented from this gold standard model. I think, pick up those materials, start reading about DBT, start reading up on skills, because you can use DBT skills with any client who's engaged or that's interested. These skills can be implemented so easily with anyone. It doesn't have to be someone who's going to the group and doing the phone coaching. Any client can benefit from DBT. So I think if you're interested, pick up the skills workbook, pick up a diary card and see what it's about. Start reading.
Mm.
That's where it starts. If you are interested, read. All of those models, we pick up a book, we start reading, we listen to a podcast that sparks our interest, and then it's like, oh, I could do that. But I think a lot of people get discouraged with DBT because it feels so rigid. And it's kind of discouraging of like, oh, I can't do that in my practice, or I don't have enough training accessibility to go and implement this. But that's okay. Pick up a few skills, try implementing them with clients that you think could really benefit from it, see where it goes. I think
Yeah.
there's a lot of wonder in DBT, and follow that wonder.
Well, and I just thought of this, because I think actually when it comes to this population, one of the ways that DBT could be so helpful is because, we talk about this with sub skills like, say, effective rethinking and paired relaxation, right? It's a great skill to use when you have something in your life that's coming up on a regular basis and you want
Absolutely.
to be able to, prepare for it and cope with it in a different way. And so I'm just thinking of like, professionals who might be sitting with clients, let's say you're sitting with a client who has like a 5-month-old baby,
Yep.
and they're coming into session with you and they're just talking about like how stressed out they're feeling, every time that their baby wakes up in the middle of the night, or
Yep.
if somebody's struggling with feeding challenges, and so they notice themselves getting anxious every feed. You're gonna have these situations when you're a new parent that come up over and over and over and over again, like
Yep.
on a daily basis, where then you as the clinician can be like, hey, let's try a skill here.
Let's use this skill. Let's
Yeah.
use Cope Ahead to
Yep.
plan for, when you get really anxious around like your child's feeding difficulty, or when your child wakes up recurrently at 3 a.m. and it just feels like dread over and
Mhm.
over again, or when you have to walk into that IVF clinic and get your day 3 labs, or any of those scenarios. That's how DBT can be so accessible and used so many different places.
Yeah, yeah, it's really true. I mean, because we say this a lot, like, you don't have to wait for the crisis to use
No.
DBT. Actually, don't wait for the
You're
crisis
supposed to
because,
use it in mundane situations to
yeah,
have it ready for the crisis.
yeah, that's exactly what we say all the time. And so, yeah, I can actually think of how professionals may find that their clients who, yeah, are in new parenthood, or, wherever they're at on that perinatal mental health spectrum of things with the journey that can get you to parenthood, is like, yeah, that this may be what they're really looking for. Like they want something concrete that they can try out, hopefully see some, relatively quick results from,
Absolutely.
and that will help them just kind of like survive their day-to-day reality.
Totally. Like you going for an ultrasound for your first visit after a pregnancy loss mindfulness is a great skill to plug in there, to manage your anxiety at that first ultrasound. Things like that, they're so applicable in these situations.
Nicely a la carte kind of skills.
Exactly.
I feel like we keep managing to ask you a similar question in different ways, but hopefully we're not coming across too redundant, because we were talking about like what to tell mental health professionals, like how can they integrate this work more into their clients' lives. But if you're just talking directly to, our layperson listeners, who might be expecting or who might be new parents or who are on this journey themselves, like what would you, like the biggest thing you would want them to remember about how they can bring DBT into their lives, or how it can benefit them during this part of their journey?
Yeah, I think similarly to what we were just talking about, pulling from these skills kind of a la carte rather than the DBT buffet. There's great skills in each of these modules, whether it's emotion regulation or distress tolerance and mindfulness. There's such great skills within DBT to pull apart for no matter what phase you're in of parenthood, whether you're trying to conceive, you're in those early phases and so anxious, or you're in the thick of it and feeling like you've lost your mind. There's some really great skills to just bring you back down and center you and find some of that calming force again to help you feel grounded, no matter where you're at. DBT can be such a great skill set to help you feel balanced and whole and get back to the basics. I was just having this conversation with my own therapist the other day that we listen to these like parenting experts like Dr. Becky and things like that they're great skills, and at the root of it, like, it's still individual for every child, for every parent and things like that. But if you're in such a dysregulated place, those skills don't do anything for you. So you still have to get back to being grounded, being at a good calm baseline to be able to implement those things. And I think that's where DBT skills can be so helpful to get you back to that grounded baseline to implement those other things like good parenting skills and IFS and things like that.
Kind of a frontline defense of skills that you can use to get yourself into a better space.
It's like a tourniquet, stop the bleeding and then put the Band-Aid on. You don't put a Band-Aid on when you're bleeding profusely.
Yeah, that's a good way to look at it. All right, so that brings us to the end of our questions. So I will preface this by saying all that Whitney is about to talk about, we will be putting links in our Facebook group. So if you are wanting to check out any of this stuff, head over there, and we'll have links for you. But Whitney, tell us your websites, anything that you want to promote, that you want our listeners to know about, because you have so many great resources with the work that you're doing. So we'd love to just get some nuts and bolts there of where people can find out more about you.
Awesome. Thank you. So in 2021, I published 2 books or treatment journals from a DBT perspective. So my first journal is the Borderline Personality Disorder Journal, which includes DBT prompts and practices to manage symptoms and achieve balance for folks either diagnosed or suspecting a diagnosis of borderline personality disorder. And then the second is the Bipolar Disorder Journal, which is guided prompts to help manage you, understand, track, and manage your symptoms. And that is from a DBT perspective as well. Both of those you can find on Amazon. And then my private practice website is peacefuljourneyscounseling.com. And there you can find all of my training resources, so DBT training for other therapists, clinical supervision for therapists in training and interns that are master level, as well as scheduling case consultation or therapy sessions with me. And then the RileyCenter.com is my perinatal mental health collective here in Colorado.
I was going to say, lucky all of you listeners in Colorado to have this resource. Amazing.
Okay. That's true. What are you going to be up to, Michelle?
Yeah, we figured before we get into the closing moment, it might be important to tell you all what you can expect over the next few months because, as we said at the beginning, this will be our last episode that we're releasing. I realized, we are, of course, recording this before the release date. You all will be getting this episode released to you on April 24th.
You will no longer be pregnant
by then. Yes, I will no longer be pregnant by the 24th. So, yeah, as you're listening to this, I will then be a mom of 2. But basically, yeah, we're releasing this episode. And then, hopefully the plan is that we'll get back to releasing a monthly episode again in August. I would say that will be our goal for when you guys can get your next monthly episode. In the meantime, we are trying to do what we did the last time I took maternity leave, which is record a bunch of Q&As so that you'll have something to tide you over during these months while we're not recording monthly episodes. So those will be coming, and Kate and I still have, as we record this episode with Whitney, we still have a few more Q&As.
A few more days.
We're gonna get to. But, so you'll be seeing Q&As posted over the next few months, but then we will officially be back at it in August, or maybe as late as September, just depending on where I'm at with things. So that's the plan. Yeah.
I'm excited to meet your tiny one.
I know. I'm very excited too. Yeah, I will say this just because I think it's a fun tidbit for our listeners to know, right? Like we mentioned that you are the goddess mother to to this little one, but going back to some of the stuff we were really talking about today about like, gosh, how important it is to have that support postpartum, right? Mm-hmm. For birthing people to not be alone so soon Absolutely. After giving birth. Yeah, and Kate's gonna be coming to stay with me for a little while. Yeah.
Your own little postpartum doula, Kate.
Basically, yeah. She's gonna be there to do a lot of helping with my son in particular because I'm gonna be having a C-section, and I mean, you spoke to this a little bit, Whitney, right? Like, just it's a different recovery process when you have a C-section. And I was just kind of like, yep, we're gonna need an extra set of hands for the things that I'm not going to be able to do for him those first few weeks when I'm recovering from a major surgery, from that standpoint. So, yeah, Kate will be coming to stay with me, and I'm very much looking forward to having her support. So also, while you guys are listening to this episode, Kate is at my house. She'll be there when
That's true. I'm living with Michelle.
Yep, yeah, for a couple weeks.
I get to be live-in help for a few weeks, which is very exciting.
Yeah, exactly.
Special.
Thanks.
So Kate, bring your DBT skills.
Yeah.
And remind her.
Right? Let's do some mindfulness, some mindful breathing.
When Michelle's losing it at 3 a.m., because the baby is up, remind her. Let's radically accept this moment, Michelle.
I'm sure she'll be very excited to hear me say that.
I'm sure she'll probably throw something at you.
Oh my gosh. All right. I will admit, Michelle, one of the things I had thought about doing for your baby shower was there's a thing where you buy a bunch of diapers of whatever kind the parents are going to be using. But that box is explicitly for middle of the night changings, and people write things on the diapers.
They write
in,
funny
Sharpies.
things on them.
Yep.
To keep it lighthearted in the middle of the night.
Exactly. Like, this too shall pass, or like you were excited about this a month ago. I don't know, like whatever.
I've done that at a baby shower before.
Right?
I have. I thought it was funny.
So I did. I thought about doing that one because I was thinking about that the middle of the night, like changings, etc. So anyway. Well, thank you again so much, Whitney. We love having guests, and it was just truly, as you said, kismet timing for the subject matter at hand.
Yes.
So we're so glad to have you, and I think we're ready for closing moment. What do people think?
Are you ready? So, yeah. Take it away, Kate.
I apologize, by the way, in advance, guys. I think hopefully our wonderful editing humans have cleared out most of clearing my throat, but I'm still getting over being sick and Goddess knows I'll end up doing something in the middle of closing moment, so fingers crossed, we'll see. Okay. To start with, just go ahead and get comfortable as per usual. Whatever feels good and right in your body right now. Sitting, standing, laying down. And to begin with, we're going to start by just noticing our breath. You don't need to breathe any more slowly or any more deeply than you are naturally. It's just about paying attention. Just about tuning in and focusing in on the rhythms and the sensations of your breath and letting them welcome you into your body and into the present moment. So to begin with today, go ahead and stay with your breath as I talk. If your mind wanders away from your breath or away from my voice, just go ahead and gently bring it back. I'd like you to consider today that we all have a relationship to the idea of parenthood. Whether you are already a parent, whether you never want to be a parent, whether you're yearning to become a parent. In some way, shape, or form, you have a relationship to this idea or to this role. So for today's meditation, I'd love for you to consider, what is your relationship to this concept? When you think about the idea of being a parent, what emotions come up for you? What narratives do you have around the expectation that you be a parent, be it your own expectation, familial expectation, societal expectation? If it's something that you're reaching for and haven't yet been able to get your hands on, what emotions are there for you? What pains, what griefs, what yearnings? Whether it be something that we are terrified of or drawn to or anything in the middle. We've all considered what it might be to be a parent in our life. Why we want to or don't want to do it. If you're pregnant right now or part of a relationship that has a pregnancy, what is that like for you in this moment? Where is your excitement, your fear? What's the sense of the unknown? There are no wrong answers here. There are no inappropriate emotions as a part of this journey. This is just a moment to be curious. To ask yourself the questions and make space for the answer, whatever they may be. Something strong has come up for you during this. I recommend considering the idea of taking a moment to journal or talk it out with somebody after the closing moment today. But for now, you can just take a couple of slow, deep breaths. Maybe rotate your neck or shoulders, wrists or ankles. Doing some gentle stretching if that's what your body needs or wants in this moment. And when you're ready, you can open your eyes. Thanks so much, everyone.
Thanks, everybody. And thanks, Whitney, for being here.
Yeah, thank you, Whitney.
Thank you for having me.
To learn more about us and the DBT skills we're teaching each week, join our Facebook group. Simply log in to your Facebook profile and search for DBT and Me Podcast.